Welcome to the Weigh In Podcast, your prescription for a healthier life, where wellness is more than just a number on a scale. We'll dive deep into not just weight loss, but the medical, emotional, and lifestyle aspects of well-being.
In each episode, we'll weigh in on hot topics ranging from diet myths and exercise trends to mental health and chronic disease management, providing you with the evidence-based advice to guide your health decisions. Remember, it's not just about the weight on the scale, but about creating a healthier, more balanced you.
Hello, my friend. How are you?
I'm doing great. How are you doing?
Good. You look lovely. What's up with these earrings? Are these cherries I see?
Yes, they are.
I would do. Except they would be like hearts. I love this. They're really cute.
Thank you.
It's giving
they're
summer.
my fun earrings. Yes, exactly.
Okay, so our plan for today is to do a fun little Q&A session. You are to hormones as I am to weight loss and metabolic health. So this would be really cool to have a chance to learn all about hormones from you. This will be cool. This will be cool not just for my patients and for our listeners, but also for me to hear because, like I said, there are a few people that are as well-versed in HRT as you have become. Yeah, are you ready? Thoughts?
Yeah. No, I'm excited because I know we've been hinting at this for a while, and I just want to do a 101 of HRT before we kind of get more into deeper topics. So this is just a intro and just a preface. Like a lot of my information is from World Link, and I have taken quite a number of different hormone trainings. And so I'm not just being biased with just one source, and I think that's really important to know when you're doing HRT because there's going to be a lot of different research out there that can prove anything any other way. But I do want to just break into that mold of which research is appropriate and why do we do what we do. And so I think that's just really important as a patient to go into is to know what your provider is doing, why they're doing it, because we want this to make sense for you as it makes sense for us. But, we're medically trained. And so the way we think is a little different from how a patient that doesn't have any medical background thinks. And so we want this to be something that you can get something out of and make sure that you understand this because hormones are very important in our lives, but I want to make sure that you're getting it done the right way because there are different providers that do things differently. So yeah, very excited.
And as a small plug for Czarina, because she's too humble to do it, if you listen to this and you're like, oh my gosh, I love how Czarina talks about HRT, I want more. Czarina has her own solo show that is fully dedicated to hormone replacement therapy. Tell us a little bit about that, Czarina.
Yes, on TikTok and Instagram, every Tuesday I've been doing just these small little bits, like 1-minute episodes. The series is called The Hormone Fix, and it's also just a 101 and eventually a deep dive into HRT. So I already have my first episode out this week. And again, it's on TikTok. My handle is the A-List Clinic on both TikTok and Instagram. So if you are just wanting to get into it and not wanting to spend like a whole hour or something, it's just these 1-minute bits.
If you ain't trying to do WorldLink.
Yeah. If you have ADHD or something, it's totally perfect for you. So yeah.
Perfect.
So I'm ready.
All right, cool. Let's get into it. All right. So first question is, what led you to start exploring HRT in your own life and also in your A-List Clinic practice?
So my own experience with HRT or hormones, it's been with birth control. I've been on oral birth control on and on throughout my life, on and off, I should say. And I never had any bad side effects, luckily. Like I know people say they have mood swings and crazy weight gain. My personal experience has just been that it was fine. Like I did notice some minor weight gain, but otherwise it wasn't crazy for me. I was mainly taking it for preventing pregnancy, of course. I didn't have any other issues like PCOS or anything else that needed it. Like my periods aren't crazy, thank goodness. Like without birth control, even prior, my periods would be usually like 3 or 4 days or so. And it was pretty medium. I wouldn't have any heavy cramps or anything like that. And I know other people take birth control for those reasons. Just me personally, I just wanted to try to see what it was like without it. I had been seeing people using the Aura Ring, which I currently have, and I think Katie has one too. And they were using the Aura Ring with natural cycles. And so originally I was just using natural cycles on its own because you can use a thermometer to measure your temperature, but it had to be like the right conditions. You had to wake up usually at the same time every day and not have been hungover or sick, or there's certain conditions where the temperature's not accurate. And so it takes about 3 months for it to even calibrate and get used to you. So eventually I was just like, I want to do the Aura Ring because it gets an average of your basal body temperature because you're wearing it all day and all night. And so I found that more appropriate, and I felt like it was more accurate than just taking it in the morning. So yeah, it's been very cool. Like the Natural Cycles app will get used to your periods, and after 3 months or so it'll predict pretty accurately when your periods are going to be, so it gives you a range of like a few days.
And
it
so
can
to
also
clarify, the Natural Cycles app, it's integrated with the Aura Ring.
yeah, they talk to each other, but they're
Okay.
two separate apps, two separate
Okay.
things. Yes. This could also be covered by your HSA or FSA if you turn it into your insurance for reimbursement as well. So Natural Cycles can also tell you when you're ovulating. I also like that it breaks down your phases, like your menstrual cycle. It had always confused me for the longest time, and now I know exactly like what's what, especially when you're getting to like your luteal phase, and like that's typically the last 2 weeks of your cycle. So I'll rewind and start from the beginning. So usually for your menstrual cycle, like when you first have your period, that's actually like the first day of your cycle. And then after your period, you go into like what's called the follicular phase, and that's where your estrogen's the highest, and you feel amazing. Like you can do a lot of heavy workouts. You can do a lot of. You're very creative. You have so much energy. You can probably go out all night and then come back to work and you're fine. Your mood is great. You're just generally you're doing well. And then you go into your ovulatory phase. That's where the egg is coming out. And then after that, you go into your luteal phase. And that's when your progesterone is, if you were pregnant, this is to help prepare you for a pregnancy. It's helping you with your fertility, helping your uterus and all that. And so that's your luteal phase. And this is usually the time where you start to kind of slack off, like mentally and emotionally. Or you could be moody. This is also where you experience some moodiness and stuff. That's because your body is, again, preparing for either a baby. And if you don't have a baby, then it's going to be your period. So, and this is also where you tend to have cravings, like especially really bad cravings, because again, you're preparing for your period. So if you tend to have PMS or PMDD, this area is usually like really terrible. And then you go back into your period and then it starts all over again. So the Natural Cycles app, how it helps me prevent pregnancy is you have your red days and your green days. Red days is when you shouldn't have any intercourse, so you should use protection. Green days is when you're like all good, because you can't get pregnant like every single day of your cycle. So that's why they say like the 5 days during the ovulation, because sperm can last in your system for like 5 days, So it was
Although,
really
ladies,
fascinating.
disclaimer, natural family planning can be very effective. However, just so you know, it does not completely eliminate the risk of pregnancy. I usually advise people this is something to do if you don't really want to be pregnant, but wouldn't be horrified if you got pregnant, type of deal.
Yes, and also STDs as well. So that's something you should also be aware of. Yeah. So the reason why I did the Aura Ring with Natural Cycles is that I was like, had some level of okayness with if I were to get pregnant, that's the conversation you need to have with you and your partner. Thank you for clarifying, Katie.
I'm
Anyway, it's
seeing
been
no
about
more kids, so I had to point it out for those of us who
right, exactly. Yeah, so I've been doing this for about a year now and haven't had any problems, haven't had a baby. And overall, like how I feel, I really like just not being on the medication on oral birth control, because I also felt like I could, like when I looked back at the old podcast when I was on birth control, like I was like a little puffy and stuff. And so it's really funny just to look back at that and see I don't feel that like puffiness anymore. So it's been great for me. And if that's something you want to try, then I think people should do it. Aside from that, I mean, there's also some side effects from oral birth control. You can have risk of stroke, heart attacks, blood clots, etc., especially if you're a smoker or if you just tend to like live a sedentary lifestyle. So that was just something that I didn't really want to deal with. And so answering your second question, how did it translate into my practice, was that if there's other conditions that we could treat without synthetics, then how can I make an impact? I felt like the way we both started was with weight loss, and especially with the GLP-1s. I mean, it's basically we have GLP-1 hormones in our body. And so that's exactly what the Wegovy, Ozempic, semaglutide, tirzepatide, that's what they all do. It's basically mimicking those gut hormones in our body. And so I felt like using GLP-1s is a great starting off point if you wanted to explore HRT, because I think it is a form of HRT. Like it is a hormone. And how I got started, I basically took this public course out in Texas. And they were very great. That's how I got into this whole spiral of HRT. And then I ended up taking a bunch of other classes, reading a lot of books. Again, I really love WorldLink. I think it is a great resource for those providers who want to get into HRT, but you're scared and you just don't know where to start. Like Neil Rousier breaks it down for you. It's a really great investment. Personally, he's done this for over 25 years. He's like the leader of HRT, I would say. And I've also read some books. Estrogen Matters is also a great book by Avram Blooming. He's a doctor. I think he was based out in Cedars-Sinai. His wife got breast cancer, and she was on the tamoxifen and the AI inhibitors and aromatase inhibitors, I should say. And she felt nearly suicidal. She was done with all the treatments. She felt like crap. And she told her husband this. And then he finally was like, well, oh crap. Like, I can't. No way. Like, I need to figure out what to do with this. And so he did his own research and wrote this book, and it's amazing.
And to clarify, Estrogen Matters is kind of a book that's like for the people, right? So WorldLink is like for medical providers. For those of you that are not providers, I don't know that it would be useful for you, but Estrogen Matters is like grab it off of Amazon. Anybody can read it and get a lot out of it, just to clarify, right?
Yeah, he can go a little bit medical, but like it's still, I think, like he uses really good lay terms. He's very easy to understand. So I think, yeah, it's appropriate for anybody.
Love that. And just to go rewind back a little bit, just one quick question I had for you was you were going through the cycles when you were talking about the Aura Ring. And do you mind just clarifying for people very quickly? A lot of women are getting their labs done for hormones and they get those lab panels back. What is like when they're getting like their LH levels back and they're getting those levels back? Can you just explain like what we're looking for when we do that, when we draw those labs?
Yes. So depending on what's your age, what's your symptoms that you're having, and also dependent on the day of the cycle that they're drawn, that's really important to know because we need to figure out where you are in your cycle. But if you're, for example, say someone who has PCOS, like your cycles are irregular, what you would see is called like a FSH LH flip. Again, like towards the first half of your cycle, your FSH, your follicular stimulating hormone, should be pretty high because again, you're like stimulating the follicles to try to get the eggs ready for pregnancy. And then later on is your luteal phase. That's when you're trying to get your body ready for a potential pregnancy. But if these are off, then either that could indicate some PCOS possibly. And then if you're also menopausal, your FSH levels would be very low because it's just not where your ovaries aren't doing anything anymore. So it's really important to have a good provider that can understand these labs and know where you're at exactly and correlate them with the symptoms. Because, for example, for perimenopause, like you shouldn't be receiving estrogen. It's not really until you get a full year of no periods and then your FSH level is low. But a lot of providers can get confused because perimenopause looks a lot like menopause. It's all the same symptoms. So that's what the FSH and LH labs are about.
Well, thank you for that clarification. All right, let's see here because I got more questions. Okay, was there a moment when you realized HRT was underrated or misunderstood?
Yeah, I had to do some deep self-examining within myself because I don't know if this is true for you when you went to school, but when I went to school for NP, like I was taught hormones are terrible or bad. So I already had that bias in my head that I would see all these other providers doing HRT and I'm like, what are you doing? Like, this is so dangerous. Why are you? There's so many risks with HRT, especially with testosterone, with the blood clots and cardiovascular disease. So I thought everyone was crazy. Just a switch just flipped into me. And somehow I just got into this spiral with knowing more about HRT. Like, it's like, okay, if these other providers are doing it, there must be a reason behind it. So I wanted to explore that and see what it was about. There's just a stigma in general, like even with patients that I talk to currently, a lot of education needs to happen because they also think the HRT is bad, that it'll cause cancer, it'll cause all these bad things. And I totally get it. Like we will go into this later, but there was a study done about in 2002 called the Women's Health Initiative, and it's completely just made HRT look like the bad guy, which is sad. Like, so many people are being undertreated, and they're not using hormones because of this study. And so I think HRT is superly misunderstood. I think that people tend to just jump to conclusions when it comes to HRT, because I think that, I heard a bad thing about, like, say, for example, Provera. I heard a bad thing about that. So they think that all hormones are bad. And that's not necessarily true. What we like to advocate is for bioidentical hormone replacement therapy. And these are found through compounding pharmacies because they actually are the most chemically closest to what we make in our bodies versus the synthetic hormones. Like, it could say that it has estrogen in it, but like there could be a lot of other additives as well. And it also depends on the type of estrogen that you're getting. Estradiol has been proven to have a lot of good effects on the body versus just, estriol or estrone. There's so many different types of estrogens out there, but estradiol is the one that's actually super good for us, for men and women.
Tell me in terms of how your perspective shifted. So, like, how did your perspective shift once you actually learned the science behind the hormones?
Well, I started looking around and just thinking, like, I think we're all hormonally deprived in a sense, because can you imagine, everyone complains about how tired they are and how they want to lose weight because they've gained so much weight after 30 or after a certain point in their 20s. And I think that they can examine probably their thyroid, they could examine their testosterone, and I know there's some lifestyle changes as well. Obviously, I mean, you probably got married, had kids, you're working a lot. But if we optimize our sleep, if we do better with our food, with our eating habits, that's one part of the puzzle. But I think if you actually do it also chemically, can you imagine like how much better you could feel on top of that? Like, especially if you're having PCOS or low testosterone, like, yeah, there's foods that can help support it. But like, we're in the hospital and you have low potassium, you have low magnesium. What do they give you? They give you potassium,
Right.
They give you magnesium. So that's just how I see it too.
No, that makes total sense. I actually completely agree with you. What is the biggest myth you wish that people would stop believing about HRT?
Yes, I'm going to go into this pretty in depth. Basically, the biggest myth is that people think that HRT is bad for us. And as I had alluded to earlier, it's that Women's Health Initiative, that study that happened from 2002 to 2006. It concluded early because of the National Heart, Lung, and Blood Institute said that the breast cancer incidences and other health risks of hormone treatment were greater than the benefits. So they actually wanted this study to go on longer, for I think 8 years. It only went on for like 5. So this was a pretty big study. It was randomized. They had about like, I want to say 160,000 women in this initiative. And they wanted to compare the risks and benefits of HRT versus not being on HRT with coronary heart disease. Now, I will say the hormones that they were using were synthetic estrogen and synthetic progestin. So the control group were women that had not been on HRT. But the flaw is that these women had been on HRT, but they stopped. But that's not something that they say in the study. They just say that they're not using it, that they weren't on it, not that they had done it in the past and stopped. And so there was just a lot of flaws with this study. So this is where everyone concluded, especially Dr. Joanne Manson, who had performed this. She's on her soapbox saying, like, we need to stop all hormones. It is causing blood clots. It is causing breast cancer. It is causing cardiovascular disease, which has been completely unfounded, outdated. It's been 20 something years, and there's been way more studies to prove that this is incorrect. Actually, there's a doctor, her name is Dr. Rebecca Glazer, and she's performing testosterone pellets on women that have active breast cancer. And it's shown that it's actually stopped the tumor from growing, if not made the breast cancer go away. But again, like, people don't want to focus on it. They want to focus on the fact that it's bad for you. The reason why is because, kind of going on to a statistics type of mode here, and I'll break it down to make it easy. Basically, what they used in the study was called relative risk. Relative risk is the probability of an event between two groups. So basically, we have the two groups of the HRT versus non-HRT. So it made it seem like it was very significant with just using relative risk. And then absolute risk is the straightforward probability of it happening in a specific group. So if we looked at the absolute risk, it was percent, which is actually very insignificant. So how this translates is for the estrogen and progestin group, their chances of getting cardiovascular disease and other risks are 37 people per 1,000 people. And then the control group, the ones that didn't take the HRT, it was 30 per 10,000. So this was a critique by James Clark in the NIH. So comparing both of them, there's really not that much significance between the both groups that were doing the HRT. And the way I like to compare this is, I don't know if you've been keeping up with the California news at all, but basically the senator from Alabama, Senator Tommy Tuberville, he said that LA looks like a third world country, that the anarchists are in charge, law enforcement is being attacked, and the rule of law is non-existent. And then Gavin Newsom had come back to him and said, well, Alabama has like 3 times the homicide rate than California. So the perception is a big thing here, but when you actually look at the facts, in the CDC, Alabama ranked 3rd in the country with the homicide rates. So it's 14.9 per 100,000 population. And then California, we ranked 5.9 per 100,000 population. So how does that break down? Basically, Alabama does have 2.5 times more homicide than California does. Depending on how you break down the numbers, it might look like it's big to you or the perception of what you're told. But again, when we broke down the numbers of the group that had the HRT versus non-HRT, it's insignificant of getting those risks of cardiovascular disease, etc. When you're using bioidentical hormones, it's actually super beneficial for so many things. I don't think that you need to be using statins because they actually aren't they actually don't reduce your coronary artery calcification. That's what's measured in your blood vessels to see if you have a high risk of getting a clot or a stroke or blockage, because estrogen and testosterone actually help with that. Same with your bone mass as well. Like having estrogen and testosterone is actually really good for your bone mass and also helps decrease visceral fat. If you decrease visceral fat, like that's the main target to like help reduce everything else. Insulin resistance.
Yep.
Cardiovascular disease, blood clots, stroke, etc. So that's really the main thing. But yet in traditional medicine, we're using a bunch of other things like biphosphonates and again, statins and etc. They just don't want to use the hormones because who knows? I mean, really, a lot of it is because they can't patent hormones. And so there's really no financial gain for the pharmaceutical company to get by trying to promote hormones. They would rather use these synthetic drugs because it makes more money for them, even though it doesn't really help as much as HRT.
Yeah, and just to pause and rewind to what you said before so that we can make sure everybody's still with us. So what Czarina is referring to is this study that happened back in, I think it was 2002. Basically, this study made everybody scared of HRT. And the biggest thing you should know about this study is that it used synthetic hormones. It didn't use bioidentical hormones, which is what we're using today. And on top of that, the risks that they found were really tiny and insignificant anyway. Yet this study ended up being like a media frenzy. It ended up making everybody scared of HRT. And as a result, it almost has gone down in history as sort of being this like catalyst of misinformation. When we're taught about HRT as medical providers, they always reference this study. Like it's always like the misinformation started here. So that's why Czarina's bring it up, is because a lot of the misinformation that so many of us have, I mean, even I had these biases going into it, come from this study. You know what I mean? It's really actually really interesting how in many ways media sometimes takes results and like really twists them. And these sort of like these pieces of information that are actually invalid are still being held true by so many people, but it's wrong.
Yeah, exactly. So that's why, like I said in the beginning, like you really do need to do your own research, because don't just listen to me and what I say. Like I did my own work, and I think it's important that you do too, again, to just make sure that you're getting the right treatment and that you know what you're going into. If you go to your doctor with this and be like, I want to get my hormones checked, they're going to think that you're crazy because they weren't taught this in school. Again, what they learn in school is that hormones are bad, and that's it.
And from a primary, and I totally agree that many of them are going to look at you like you're crazy. But the other piece here is we all know that primary care is like super, super busy. And at the end of the day, their focus, as it should be, is to help you if they think that you are sick. Right. And so even though when your hormones are totally messed up, you certainly feel awful, right? It doesn't carry the same weight to them that maybe the person that's coming in with, I don't know, some like chronic wound. Right? And so for that reason, when they're triaging what they think is significant or important for them to prioritize in your primary care visit, unfortunately, lab interpretation and hormone labs kind of goes on the back burner. And for those providers that are in that situation, I don't think that it's a bad thing necessarily. I think that the sort of solution is to find a hormone therapy provider who can kind of give you that attention. Because like I said, it's twofold. It's providers who, yes, don't believe in any of this, but there's also providers who just simply do not have the time.
Right. And if you're seeing a provider that works in insurance, typically they're seeing 20 to 30 patients a day. Visits should be about an hour, but they only get 15 minutes. So unfortunately, they have to cram everything. All they focus on is really your blood pressure, your hemoglobin A1C, your blood sugar over the past 3 months. That's really kind of their primary focus, unfortunately. So they just do not have the time or the education to really know about what hormones are. They might refer you to some specialists, but you would be surprised. Like you would think an OBGYN would know about this, but they do not. So if that was another thing that you were thinking of, oh, let me go to OBGYN or let me go to a urologist. Some of these providers also do not have the adequate training for hormones. So that's just something to be aware of.
And we're saying keyword some. She's not saying all.
Yes.
There's definitely some very woke primary care providers and some very woke urologists, some very woke OBGYNs. She just referenced saying what the unfortunate norm is right now.
Yeah. So if just on a side note, if you are looking for somebody that can do this, then usually you want to go to someone that has a private practice. They have more time for you. They have done the research, they've done the education. So that would be my advice.
Well said. All right, next question. We kind of like referenced this before a little bit, but it would be great if you could clarify for people. What's the difference between bioidentical and synthetic hormones, and why should people care?
Yes, so bioidentical hormones, they replicate the exact molecular structure of naturally produced hormones. They are derived from plants, sometimes even yams, from what I've read. They do not have the associated risks such as the synthetic hormones like Provera. And again, they are very, very chemically similar to our hormones that we produce in our body without the additives that are included with synthetic hormones. And the closest example that I can give is, probably the semaglutide and the tirzepatide. Those are pretty much similar to our GLP-1 hormones that we have in our body. I think that's why you should look into bioidentical versus synthetic. It's just less side effects. And there's many research and studies to show that bioidentical hormone replacement therapy is safe for you.
And so a lot of people think that hormone therapy is for people who are getting hot flashes or for people who like don't have a period anymore. Can you explain what some of the symptoms are that should be like a red flag for somebody who's concerned about what their hormone status might be?
Yeah. Unfortunately, the symptoms are very vague, but probably something that everyone has had at some point. So it would be fatigue, maybe depression, anxiety, low libido, erectile dysfunction, weight gain, insomnia. If you're perimenopausal, you can also have hot flashes and temperature dysregulation. If you're having some thyroid issues, you could just have like cold intolerance, maybe some brittle nails and hair. So very vague. The way you can get this checked out is just to get your labs done, like a comprehensive lab assessment, looking at everything. And that'll let your provider know which hormones that you're deficient at. And even if it looks normal on the lab ranges, like you're still having symptoms, so they could be better. And that's like what we like to call optimized. We like to dial you into the right dose for you. And those symptoms should go away once we get your hormones optimized.
And dude, one other side effect is for low T, definitely for men and women, lack of motivation. That is like a really, really common symptom. And that's like probably the vaguest symptom of all time, but it's the main thing that people say they feel is like a huge difference once they're on testosterone. Even my like wives of guys that get T are like, dude, like he would never even like want to get out of bed or mow the lawn. And now he just seems like so much more motivated. So just like this general like feeling of blah and lack of motivation is totally a symptom. Just something to think about.
Yeah. And I feel like guys aren't straightforward about this because they feel like, well, like, I'm a guy, I'm macho. So they might not want to come forward with that information. But yeah, like Katie said, I mean, if your husband feels that way, don't feel scared to like bring that up to your provider, because they could probably bring it up in a different way. If your husband's not like straightforward with you, if maybe if they talk to a provider, it might be a little different.
Very, very true. We're starting to see like some couples that want to like come in and get pelleted together, which is really cool.
Yeah.
So definitely it can be something that you guys do together. Now, that being
Absolutely.
said, who would you not recommend HRT for? I know we're like HRTs to everybody, but who should absolutely not have HRT?
Truly, I mean, if you're not open to it, then you probably shouldn't do it, because you're just, again, just mentally going to be thinking, no, 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 like this is not for me. Like I've said, there's many studies to prove that HRT is safe. Probably the one that does come to mind is, say, like if you have history of blood clots or cancer and you're worried that it'll make it come back or make it worse. Again, there's like no studies to show that HRT does this, because I know with, for example, breast cancer, they use tamoxifen or aromatase inhibitors because they think that estrogen makes this worse or makes it come back. Again, like there have been studies done where they did use testosterone to help prevent breast cancer, help it stop the growth, and it has been proven to work. And this is out in Europe. So yeah, if you're just not open to it, then I would just say I think it's just something that you shouldn't, a road that you shouldn't go down on, because you're going to have other people that agree with you. Of course, traditional providers that aren't trained in HRT. So you really need to just do your research, do the work, and see why it's been working for other people and how it could work for you. If it's something that you're afraid of, then I think then it's just going to be a no-go. Again, there's so many resources out there that I would love to share. So if you're open to it, then let's do it.
So are there any are there specific people who have like specific parts of their history who just shouldn't even bother looking into HRT?
Again, no, it's really more of a cover your ass type of thing. And I know some providers might feel this way too, because, like, if you really are scared of the blood clots, like for example, with this testosterone, I know some people are afraid of, well, it could cause blood clots and stuff, but it's for a very specific condition called polycythemia vera. And that's when you have your white blood cells, your red blood cells, and your platelets go up. What testosterone does is it just raises the hematocrit just slightly. And this can also be seen in patients that have sleep apnea, or if you live in a climate such as Colorado where you have high altitude. So this is something that you should talk to with your provider if there's very specific conditions that you're afraid of, and just have a talk with them. But again, like overall, HRT has been beneficial for everybody and everything. You just need to have those specific talks with them and go into the studies and see how it's beneficial for you.
I think it definitely is worth having a conversation with one's provider. The other reason why is like a lot of the things that you Google, right, they might give you information that might even be valid, but it might be specific to a specific type of hormone therapy, right? So like my concerns about giving somebody oral estrogen are different than my concerns about like pelleting somebody or giving them a different form of it. So again, it definitely is worth having a conversation with your medical provider to kind of see what would work best for you and what would be the best fit.
Well, I have an example. This happened to me recently. This is more in the hospital setting, but I was going to give a patient cryoprecipitate, and she's O positive, and the cryoprecipitate bag was A positive. So I was setting it all up, connected it to her, and then she was like, wait, is this A positive? I thought I can't get A positive. And I called the blood bank, told the doctor. The blood bank said, these are not red blood cells. So the cryoprecipitate is actually, it's cross-matched. You can get the A positive. And so I told the patient this, and she was still insistent. No, like I don't want the A positive because Chat GPT told me I cannot get A positive. So I could understand where she got to that conclusion, because yes, if you're receiving red blood cells, then you O positive can only receive certain types, right? But when it comes to cryoprecipitate, which is more for clotting factors, that's completely different. It's universal, so you could actually receive any kind, and it doesn't matter. There's no antibodies, and that's what people are concerned of. Like, what about the antibodies? There's no antibodies with that. So again, yeah, you would have to talk to your provider, have them break it down to you, because I can see when you look up something and ChatGPT says one thing. And I also think you need to give some faith into your provider as well, because ChatGPT can be mistaken. It is a robot. It doesn't replace someone's critical thinking or their years of school. So just an aside.
Absolutely. Couldn't have said it better myself. I completely agree with that. Now, common question. Does HRT help with weight loss?
Absolutely, because Testosterone, estrogen, progesterone, all of those, they actually help decrease the visceral fat. And visceral fat is the fat around your organs, which that's not good. You can't necessarily see it, but yeah, it's inside, and that's something that we don't want. So the more visceral fat that you have, it poses a whole bunch of other problems. So then your insulin resistance, your cardiovascular disease, diabetes, and it also affects your metabolism too. So I would say if you are on HRT and your hormones are optimized, you're going to have a way better time with losing weight. So definitely look into that if you're pursuing weight loss, because just doing weight loss medication doesn't have to be the one and only thing that you do. I think if you also optimize your hormones, you'll have a way better time losing weight.
Why do you think so many providers are still hesitant to prescribe HRT? You just talked about some of the studies and how many things have been debunked. So why do you think, I mean, we just kind of honed in on some of this, but is there anything else that you would add to that as to why so many providers are reluctant?
The reason why providers are scared is just they just don't have the adequate knowledge of what HRT is. And they go back to what they've learned or what they haven't learned from school, which was that hormones are bad. And they probably have a good amount of pressure from their colleagues that are just, giving them pushback, like, why are you even considering hormones at all? So that's also why providers just are scared of it. Even though the study's been debunked, it takes time for practice to actually happen. So I think it should be taught in schools. It should be taught like in courses, but unfortunately, we kind of have to do our own research and find out ourselves.
What are your thoughts on starting HRT after age 60? Dude, this question is from my mom. My mom's always like, I'm too old for HRT. So is that true? Yay or nay?
It's never too late to start. It's beneficial for you. And Neil Rousier from World Link makes this joke that he stops HRT in people over 110 years old. So he's basically just saying that anyone could take it at any time. There's so many benefits to HRT. If you want to prevent Alzheimer's, if you want to prevent cancer, especially breast cancer, colon cancer, ovarian cancer. If you want to like not fracture a bone, like especially when you are in menopause, you have a higher risk of fracturing your bone, like your hip fractures, and that debilitates you. Like after you fracture your bone, then you're stuck with a walker and then you're bedbound, and then just all these awful things that can happen after a hip fracture. If you still want to be active and you still want to exercise, you still want to travel, you still want to live your life, you want to have good quality of life, then you should definitely do HRT.
And so if somebody, let's say a female, wants to start HRT, what should they specifically be asking their doctor?
Comprehensive hormone panel, of course. So we want to be looking at your FSH, LH, your testosterone, your progesterone, your estradiol, thyroid. We could also take a look at your insulin, like your fasting insulin, on top of your hemoglobin A1C, and then your regular, CBC, complete blood count, your electrolytes, your lipid panels. And yeah, it can go even further than that. It can go to DHEA, it can go to SHBG. There's the sex hormone binding globulin. These are all pro hormones before they turn into testosterone and progesterone and estradiol, etc. So it can be super comprehensive as you want, but those are just the basics of hormone labs.
And if you're on HRT and you're still not feeling better, like what are the signs that your dose needs to be adjusted?
Like what you said, if you're still having symptoms, then probably a time to up your dose, as long as you're not really having any terrible side effects. Like, for example, with estrogen, you can have some breast tenderness or some bloating, etc. So you want to make sure that you're being titrated up slowly. Usually, I like to start off slow, go low, go slow. We can always up you. And I think patients should be patient when they start HRT, because sometimes they think that they need to feel like Superwoman or Superman when they start HRT, and that's just not necessarily true. And this is true of weight loss as well. Like when you start on weight loss medication, you're not going to drop 20 pounds in a month. It took time for you to gain the weight, so it'll take time for you to lose the weight. And that's exactly with your hormones as well. You've been living with hormone deficiency for quite a while. So for us to get you to a level where you're going to feel good, it's going to take some time. And everyone's levels are different for everybody. So if you have a friend that's on HRT and they're like, oh, I'm on this dose of testosterone and progesterone, and then you go to your doctor like, hey, my friend is on this, why am I not? Like, you're an individual person, and they're just taking their time. And so just, let it happen. And if you feel like nothing's happening, like what I like to do is have my patients, before they start HRT, I have them fill out a symptom checklist, and it has a severity of how it is. And then afterwards, like after a couple of months of therapy, I'd like them to do it again and then see how things have changed, because it might not feel immediate to you, but like progressively it's happening. And so I think it's important to just give it some time and just make sure that you set realistic expectations when it comes to HRT.
Now, how long should people expect to be on HRT?
It's a great question. Personally, I think as you get older, you get more deficient with your hormones, as evidenced by perimenopause and menopause. For men, they don't have menopause necessarily, but their testosterone does go down. Unfortunately, it's something that they should be on for life. I also think there's a lot of good protective benefits with hormones, as mentioned before. So I think it's safe. It's also similar to like taking vitamins or supplements. Like you take those every day too. Hormones are something that you could take every day as well. There's really no long-term bad side effects with them. So I think that it's definitely something that you should be taking long-term.
What pisses you off the most about women's hormones? Like about how women's hormones are treated in medicine?
They are just pushed off to the side and gaslit. I actually have a coworker who wanted to go to her traditional OBGYN. So she did. And she's pretty convinced she's in perimenopause. I believe she's in her late 40s. So she went to her OBGYN and had asked her, can I get my hormones checked? And she said, why? Like, why do you want to get your hormones checked? And she said, well, I'm just feeling more tired and I don't really feel as like energetic as I used to. And I just would rather get it checked, like, especially if it's perimenopause. I just want to know. So she was like, all right. So checked her labs, and then I don't know her exact lab results, but the provider told her, oh, they're normal. And she was like, really? And so, yeah, that was the end of that conversation. They didn't really pursue it. And unfortunately, this is how a lot of women are treated, is that like, okay, you're in perimenopause, just deal with it. Like, this is just life. And you don't have to deal with that. Like, there's treatments out there. You can definitely find an HRT provider who can treat you right, get your labs done, and interpret them appropriately and give you the right treatment so that you don't have to deal with all the symptoms that come with perimenopause. Because again, it's very similar to menopause. It doesn't mean that you have to deal with it just because your doctor told you to.
Love that. This was great. You just answered the last 3 questions beautifully without even intending to. It was like, the last question was like, what to do if you're being gaslit by your provider, and you just answered that perfectly. So yeah, thank you so much for this little chat. I think that this is a really great intro for people that are wondering if they should try hormone therapy or hormone therapy is right for you. It sounds like Czarina's saying that it definitely is worth asking your provider.
Yeah, absolutely. And don't be scared to seek it out. Again, just make sure that you do your research on your own and that you find someone who's qualified in doing HRT, because there's a lot of different ways people have been getting HRT. Like they get their Timu testosterone and their self-titrate.
No, you did not say Timu.
I sure am, because people are doing the same thing with the weight loss meds. They're getting their like Timu semaglutide, Timu tirzepatide, and these. When I say that, I mean these are research meds that aren't meant for human use, but people are using that. They're using it anyway, so it's not safe. You need to be monitored by a provider and get the results that you want. Because if you're self-titrating these medications your own, like, you don't know what you're doing. Because again, this is a prescribed medication. So just make sure that you're finding someone who is qualified in HRT that is a provider, because I've also heard about people that aren't providers, that are not doctors, not nurse practitioners. They're just a regular Smojo, and they're just prescribing things when they shouldn't. Sure, you're just doing your research, and I want to make sure that you're safe. If you've enjoyed today's episode, please take a moment to subscribe to our podcast, give us a rating, and share with your family and friends who might find it helpful.
And remember, we love hearing from our listeners. Connect with us on our social media channels or shoot us an email with your thoughts, questions, or suggestions for future topics. Don't forget to check out our website, www.thewayinandpeace.com, and to follow us on Instagram at thewayinandpeace.
If you need one-on-one help with your weight loss or wellness journey, book a private consultation with us. The A-List Clinic can be reached at www.thealistclinic.com or on Instagram and TikTok at The A-List Clinic.
And my clinic, Lifefire Weight and Wellness, can be reached at www.lifefireweight.com or on Instagram and TikTok at Lifefire Weight.
Thanks again for tuning into the Wayne Podcast with your hosts, Katie and Czarina. Until next time, take care and be well.
The information in this podcast is for general information only. It is not intended as medical advice and should not be relied upon as a substitute for medical consultation with a qualified medical provider familiar with your medical needs.